Okay, well, welcome everyone. Hello, DC Marvel friends. We're so glad you're joining us, whether you're here with us today live or listening to this at another time. We are here today with the Dream Team. We're here with the University of Arkansas research team for the DC Marvel study. About, let's say, 2.5 years ago, maybe more, you were driving in your car, bebopping, listening to the radio, when you heard this ad, or maybe a family member told you about this study being done by the university for dementia. And you raised your hand, you felt compelled, hey, I want to be a part of that. And then you joined, and surprise, you have a health coach for the next 2 years. And we are so glad that you felt compelled to raise your hand and be a part of this. And look at where we are today. We're here in 2023, and we're nearing the end of the study. Some of you are close to that, maybe a month away. Some of you maybe 6 months, and you're interested and curious of what's next. And today, that's what we hope to give some inspiration and shed some light on some of the research that we've learned and what's next on the horizon. So to get us started, I thought it would be good just to go around and do introductions with the research team, and we can start with Dr. Gray. She's our fearless leader here. So we'll start with her, just sharing your role in the study and yeah, maybe specific areas that you've been involved in the research.
Yeah, thanks, Natalie. I really appreciate it. Number one, thank you for the invitation. It's always great to speak to our research participants between when you actually come in and we're poking you with a needle and asking you to count backwards when you're walking down the hallway, et cetera. So very excited to be here today. But like Natalie said, my name's Michelle Gray. I have been here at the university since 2010. That's where all the gray hairs came from. And my role on the project really is I'm the principal investigator. So members of the NeuroTrack team and I wrote the grant that was funded by the National Institutes of Health to really provide the resources it takes to run a project like this. So my role is to hire the excellent staff that interact with you all one-on-one, and I think I've been pretty good at that so far. So, and if not, shoot me an email and I'll fix that pretty quickly. So that's my primary role, is to make sure everything is running smoothly. I work a lot behind the scenes, as you very well know. You may not have seen me in the lab as much as you've seen Megan and Anthony, and we'll see Cody this coming up semester, but that's what I do.
Yeah, thanks. And Cody, tell us about your role in the study, and yeah, anything else you want to share.
Hi, everyone. I'm the postdoc research fellow. I'm technically the project coordinator. So whenever you get an email from the aging@uark.edu email, that is me. I do all of the behind the scenes scheduling, making sure that when you come here, we get your parking, your schedule done, and then your gift cards. So anything that you get communication wise, that's coming from me. I moved here at the beginning of May of last year, so if I haven't got to meet you or communicate with you up until this point, you will be hearing from me shortly.
Great. Thanks, Cody. And Anthony.
All right, I had to unmute myself. Hi, everyone. I'm Anthony Campitelli. I'm a third-year doc student here. I had to think about that for a second. It's been so long at this point. But I'm involved directly in the study. I probably worked with many of you, if not all of you, before in some capacity, whether it was directly taking you through testing, answering your questions, or just doing blood draw or something like that. I've probably seen most of your faces, if not all of them, at some point. My role in the study is obviously, like I said, I do a lot of direct testing with participants. And I also do a lot of the statistical analysis, data science work that actually calculates scores and all of that stuff. That happens behind the scenes as well, because somebody's got to do it, and I like that stuff. So there you go. But it's a pleasure seeing you all here today. I'm glad we get to meet in a in a context where I'm not jamming a needle into your arm. So I hope we get to have a good time.
Yeah, always nice to meet under different circumstances than the needle. And Megan, love to hear from you.
Hey guys, so not much more to add. Anthony, turn your mic off. Thank you. Not much more to add. I came on to the team in August of 2020, so I've been here since day one as well. I'm also a third-year PhD student here working under Dr. Gray. So you guys are going to see me mostly in the data collection, either being the person that takes you from start to finish, or being the person that takes blood from you, and then you don't see me again the rest of the day. So I'm also kind of, running around in the background, doing data collection, doing data analysis, and writing up reports and things like that.
Yeah, thanks for sharing, everyone. It's great to hear more from you each individually on what you do here in the study. And thanks for all that you do. We keep the ship running. And look, just to get us rolling, Dr. Gray, could you maybe provide the foundation of what the study is designed to reveal?
Absolutely. It's really multifaceted, I'll be completely honest, and it's probably going to reveal a lot more at the end than I thought it would in the beginning, to be honest. But really, the overarching research question or purpose of this particular project is to look at a 2-year multi-domain intervention to try to reduce the risk of future Alzheimer's disease. We think in some individuals, it may actually improve cognition, even though that's not one of our primary outcome goals. It really is to reduce your risk because we're studying a much younger population, and only folks, this will hopefully make you feel good, only folks that do not have any sort of cognitive decline or cognitive impairment as diagnosed by a physician or as even measured in the lab with our preliminary analyses. So because you have ceiling effect, right? And you're starting out with your cognition so high, I'm not sure that that's going to change, but I'm hoping your risk factors will be improved over the course of the 2 years. We do have 2 different arms of the study. So we have a health coaching arm, which you're all involved in, and then we have what we call the health education arm, which really is control. We send those individuals a very short snippet of information, healthful information, like if you eat more green leafy vegetables, it increases your blah, 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 and it's supposed to improve your cognition over time. Or among individuals that walk at least 7,500 steps per day, we have seen a reduction in cognitive impairment later in life. So that is the other arm of the study. And I actually think you all have started to receive that information as well, or at least at some level may have received some of that information. So the 30,000-foot view, we're looking at reducing your risk of future Alzheimer's disease or cognitive impairment.
Thank you for that. Yeah, that's a great summary with that. Just seeing the 2 sides of the study, and really it's more about the reducing the risk versus like if you already have dementia, stalling that. Yeah. And Megan, is there anything that you've discovered that you can tell us about through this trial? She might be adjusting that. So
yeah, Megan, you up? Oh, geez. Technical difficulties.
That's okay. Yeah. Dr. Gray, can you tell us more about, go a little bit more into reducing the risk piece of it?
Absolutely. If you remember, the first thing that we do when you walk into the lab is we put you in front of a computer and give you a long battery of questions. That particular survey, excuse me, not the ones you take home, but the one that you actually do in the center. That particular survey is called the ANU ADRI, and I'm probably, because I don't have it written in front of me, will forget what that means, but it's the Australian National University Alzheimer's Disease Risk Index, and I think I got it correct. Anthony's proud of me. There we go. You get your kudos where you can, folks. And that particular survey, it's very long, it's very detailed. There are tons of questions in that survey, but it asks you questions related to depression. It asks you questions related to physical activity. It asks you some personal things like, are you a man or a woman, and what is your age? Based on that survey, we can determine your risk score. Now, has been a little bit done with that particular survey, and we don't know exactly what that means, right? So we don't know the difference between a score of a 13 and a score of a 14 just yet, and how meaningful those differences are. But we can certainly see if you're having a trend toward having less risk, or if you're having a trend for more risk over time. So we will be definitely comparing the two groups and finding out, did one group have a reduction in risk factors over time? Did another group have an increase in the number of risk factors or risk score over time? But we will also see for you individually, and I think it's important that you know you'll get these values. I won't go into any detail because I think someone else is going to answer that question here in a second. But more importantly, you'll see how you fared over the course of 2 years as well.
It sounds fascinating. Like there's so much here that we're going to all discover. So yeah, Megan, now that you've got things situated, we would love to hear from you. Anything that you can share about maybe what you've discovered so far.
As far as, will you repeat the question for me, Natalie?
Yeah, it's just
my laptop disconnected from internet and just messed everything up. So I'm back now though.
I've been hearing this Mercury retrograde thing for a while, so I don't know if it's in the stars. But yeah, it's pretty much from what you've been doing in the study. I know you've been involved kind of in the exercise piece, putting in some research there, some data collection. Is there anything that you've been working on that you can share with us today about this trial and this study?
From a statistical standpoint, are we diving into stats or just?
Yeah, anything you feel as though we have the freedom to disclose today.
Well, so far what we're finding is that the health coaching group is seeing some improvements in the physical function measures. So things like you come in and when you're doing your chair stand test, when we hook you up to like the Tendo, when you're doing your walking assessments, what we're seeing so far, at least after just 1 year's worth of data, is that improvements are being made, which is definitely positive and definitely things we like to see.
Okay, yeah, thank you for that. That's heartening to hear that the coaching side, we're getting stronger, it sounds like.
Yeah.
The sit to stand. So keep doing those chair squats, everybody. Yeah, and Megan, will results be interpreted in written form and verbally about these kind of discoveries at the end of the study?
So ultimately, it's going to be up to each participant. What we're going to do is we're going to compile everybody's results once we've collected all the data at time 4. So don't expect to get these results immediately when you come and see us for your 4th time point, because it's going to take us a little time to put that all together. It's not something that we can have instantaneously for you. Plus, it could add a significant amount of time at the end of your collection period when you're already here for 2.5 to 3 hours. We don't want to, draw that out anymore for you guys. We know you've got things going on in your life, and we already really appreciate the time that you're giving us. So we don't want to, drag that out anymore. So after we've collected all the data and everything, we are going to put that all together for you in a PDF document, compile it so that it's very easy to read, very easy to understand. And for some of you, that may be all you need, all you want. However, for those that may want a little more explanation, we will give you the option and communicate with you on how to set up an appointment to come back to campus, bring your results with you, and we can have a more thorough sit down and chat about what some of those results may mean.
Yeah, that sounds very supportive, and it makes sense that last test date, it's lengthy, 2.5 to 3 hours for some folks. And are you anticipating, I know this is probably a big estimation, but can they expect to get the final outcomes maybe a few months down the road, or any kind of general guide about that?
I don't want to put exact numbers on it.
Yeah.
I would definitely say a few months minimum.
Gotcha.
It's going to be within reason. We're not going be ridiculous about it. But, things like that just take time to put together.
Yeah. And just carrying on this thought, Dr. Gray, is there any plans being made for additional follow-up, like down the road?
I would love for a follow-up down the road, to be completely honest, but longitudinal studies like these are incredibly expensive. I'll be completely honest. So we will be limited by resources, including human resources. We know Megan and Anthony don't plan to be here forever, or at least I don't think they plan to be here forever. They're going to graduate in a year and a half, and I'll be sad to see them go, but be happy that they've flown the nest and they're doing amazing things wherever they are. So it's going to depend. I'll be completely honest. I have had a conversation with the NeuroTrack team about continuing, probably not as frequently as we've been interacting, definitely on the health coaching side, probably none on the health coaching side, unfortunately, but at least having a conversation about bringing folks in that want to volunteer their time to come back maybe on an annual basis or something like that. I think that would be a really excellent project for a doctoral student that's on my team to sort of take over and see into the future. I don't anticipate that it will be all 200 folks, to be completely honest, because you will see your results. You will find out if they're good, bad, or indifferent, and hopefully take with you some of the positive lifestyle behaviors that you've learned from both Natalie and Stacy over the course of these 2 years. And you'll be able to carry those on, and you won't need us anymore. But it would be fun to bring you back in and just test a handful of things. Probably not everything. I'm likely not going to stick you with a needle again. Okay. That's very expensive, number one, and it's not very fun for you if you're volunteering for these sorts of projects. But there are some easy things that we can do. We likely won't do all of the cognitive batteries that we've been doing because they take a very long period of time. But we'll pick the best ones out and continue to, or I would like to continue to do those down the road. Making no promises, but I do think it would be worthwhile, depending on what your two says, to continue to track folks and just have you come in for your own personal reasons. You just want to know what your scores are.
Yeah, I guess from a coaching perspective, that's, a 2-year study that I feel like, I call everyone DCMARVEL friends, but at this point it feels like family when you've been in a coaching relationship and you all have been in close relationships, seeing people talk, having these intimate conversations. So endings are never easy. Well, some might be easy, but this one is definitely going to be a bittersweet one, I think, for all of us. So yeah, I get that the follow-up, it will be nice to kind of touch base with some of you all and see how you're doing. And it's our hope that you do, as Dr. Gray said, continue on these with your healthy practices here. That's the name of the game. That's why we're all here, to really improve our lifestyle. Having said that, Dr. Gray, again, you're like on the hot seat today. Wondering if there will be personal recommendations from you, from the team, based on what their outcomes are.
I think there could be. I'm going to piggyback off of what Megan said a second ago. I think it's going to depend on the individual's wish to have those recommendations, right? There are so many things that you already know you're supposed to be doing. And I know Natalie and Stacy talk about those frequently because I see your feedback. I read every one of those surveys that comes through. And I know they're talking about stress and healthful eating over the holidays and increasing physical activity. And I know they're definitely a breath of fresh air, but not everyone's going to want to know what I think they should be doing, to be completely honest. Ask any of my students and trainees. But I will tell you, if you request an individual recommendation, like, look, I see this value went down. When you told me, based on what I've been doing, it should have gone up. If you ask me, and it's within my professional realm to give you that advice, I certainly will. I'm not a psychologist, so I can't talk along the lines of depression and stress and anxiety and some of those things, but I'm an exercise physiologist. So if you ask me about muscular power and how to improve muscular power, or the the 6-minute walk test, because that we know that that's related to heart health, or your blood glucose, or if you ask me about any of those things that I have the expertise to tell you, I most certainly will provide recommendations. If it's something outside of my purview, I have a handful of professionals that are in this town that can help you out if you want to seek out that sort of information and recommendations.
Man, that's phenomenal. That's wonderful that's available. You know, if you have this kind of expertise available, gosh, I would encourage you to make use of it while you can. And moving on to Anthony, this is a big one. Is wondering if you can share about if there has been up to this point, or what your takeaway is so far in the study about the difference between those who have a coach and those who are in the education side of the study.
Sorry, I have to play with the mute button. Yeah, so I would love to do that. I think for this, it would be important to break things up into time point 1, time point 2, time point 3, and then what we're expecting, hopefully, to see at time point 4. Maybe even what we're hoping to see at time point 4, although we're researchers, so we're totally non-biased and we don't care. But there's 3, as Dr. Gray kind of touched on before, there's 3 kind of broad categories that we've chosen to focus on in assessing your cognitive health. And three broad measurement techniques we're using to sort of quantify those things. Number 1 is we're using an instrument called the ECOG-12. That stands for Everyday Cognition Scale. The ECOG scale, it's one that you do before you come in for your appointment. It's part of that package of surveys that you do at each time point before you come in and meet with us. And it asks you questions like, 10 years ago, or compared to 10 years ago, how easy is it for you to remember where you placed objects? Or how easy is it for you to remember your shopping list when you go to the grocery store? And there's 12 of those questions. And so what that cognitive assessment does is it gives you an assessment of your own global cognition, or sort of your overall cognition, but it's a subjective assessment. So it's saying, okay, what do I think of how good, or how do I think I'm doing in remembering things compared to the past? So that's our first instrument. The second one is called the R bands. That's the repeatable battery. Don't remember that one off the top of my head, but the R bands test is the one that y'all take with us when you come in, and it's the one where we have you draw a figure. We give you a list of 5 words and then ask you to remember them. You've all done that a bunch of times now. I'm sure you remember with varying degrees of how much you like it. But that instrument is a more objective test of your overall cognition. So again, we're looking at that overall cognition, and it does also break it down into other constructs that have to do with cognition. But overall, we're interested in how well you remember things, how well your visual spatial processing speed is, things like that. And then the last assessment we use is the one Dr. Gray already talked about, called the ANU ADRI, and she got the name exactly right, so I won't repeat it again. But the ANU ADRI is broadly looking at Alzheimer's risk. And ultimately, that's really what we're concerned with in this study. Are we able to control that risk and in some way have some impact on prevention through health coaching? The ANU ADRI looks at 2 different components of risk. Number 1 is a risk component. So those are things that place you at higher risk for Alzheimer's. These are things like age, things like biological sex. All of those things have some impact on Alzheimer's risk. Unfortunately, a lot of those things aren't modifiable. We can't change them, right? There's no way to turn back the clock on how old you are, unfortunately. However, the other side of the equation is the protective score. So those are things that protect against risk, and through their protection actually reduce your overall risk. And there's 5 things that the ANU ADRI looks at when it comes to your protective score and how well you're protected against Alzheimer's risk. And they are: number 1, physical activity. If you recall that we asked you all those really confusing questions about physical activity. How much work do you do outside in the garden? How often do you ride the bike for transportation, that type of thing? All those questions are getting at how much physical activity you do. Other ones are how much social engagement you have, how much you interacting with friends, things like that, going out in social gatherings, how much cognitive engagement you have. That's things like reading books, doing crossword puzzles, that type of thing. And then other two sort of random ones. Number one is how much non-fried fish you consume. And then number two is, or I guess number five on my list is having 1 to 2, but no more than 2 alcoholic drinks per day. If you have more than 2, it becomes a risk factor. But if you have 1 or 2, it's actually protective against Alzheimer's. So those are the 5 things that the ANU ADRI looks at in terms of protective score. And then it kind of, all of those things are weighted into your protective score. So those are the 3 things. ECOG is our subjective score, R-bands is our more objective score, and then ANU ADRI protective score, that's a measure of your protection against Alzheimer's disease. Now, at time point 2, I should say we, because we're a team and we do these things together, we published a manuscript that assessed how we were doing in all 3 of those constructs from time point 1 to time point 2. And it looked really, really good. Health coaching was clearly had the advantage in most of those areas, particularly ECOG and your ANU ADRI protective score. So it seems like people were subjectively saying, you know what, I think I remember things a lot better than I used to. And then also, it seems like we were engaging in those behaviors that protect us against Alzheimer's with greater regularity or greater frequency. So that looked great. Time point 3, the results were a little bit more mixed. It seems that the differences between the 2 groups were tending to come back together, although both groups were still improving. Our 2 groups being you folks in the health coaching group, and then our health education group that Dr. Gray explained. However, we do see things kind of coming back together, but there's 2 things I want to point out from time point 3. Number one is that when it comes to that subjective score, the ECOG score, it seems that the only group that has improved from time 1 to time 2 to time 3 is still the health coaching group. So there is a slight edge to health coaching there. And then when we look at time 3 for that protective score, how well you're protected against Alzheimer's risk, it seems that the only the health coaching group again improved at all 3 time points. So a couple things to point out there. I think we still see this trend in favor of health coaching being very beneficial. That is closing up a little bit, but one thing that gives me cause for a little bit of hope for at time 4 that we're going to see a pretty substantial gain in the health coaching group versus our control group, the health education group, is that we still see that subjective score much better in the health coaching group. So when y'all are looking at yourself, you're saying, I'm remembering things better than I used to. And that can be some indication that things are moving. We just haven't seen them come up yet in the other in the other indexes and instruments that we're using. So I'm very hopeful for time point 4. Again, we'll have to wait till all the data come in, but we have seen up to this point some improvements in that health coaching group, and it appears that y'all are doing great. And one last thing I want to pass on, the biggest predictor in that manuscript that we published as to your success and your improvement in along all of these constructs was your adherence, was how well you adhered to the health coaching protocol. Those individuals who made more appointments and kept up on the things they were supposed to do were the individuals who saw the biggest increases and the biggest improvements. So as always, with whatever we do in the world, it's important to actually do what it is to do what it is that you set out to do, and that's being demonstrated here as well. And I think with some sort of improvements and changes we made along the way, that makes me very hopeful for time point 4, because we're already seeing much better adherence numbers.
Anthony, so well said. That was a lot. Thank you for how you broke that down. That could have been really complicated, but you really broke it down into those 3 categories. And it kind of, to me, what I'm taking from that is that piece, that protective piece, with the exercise and the nutrition, like as a coaching group, like we have the opportunity, it sounds like that spark of hope that if we can kind of dial it in a little bit more here, we can really see some significance combining that with the subjective scoring on that.
Yeah, y'all are at the finish line, so finish strong. You're doing great.
Right on. Let's go, team. Yeah, it's like you've taken the plunge, you've come this far, and sometimes we just got to shift into another gear. Like we got to put the car in motion. So, we're at the brink of this fresh new year. What better time to take advantage of the momentum of a new year and the hopefulness that comes with it to step up and dial in on the desires we have to protect our brain health and live a quality life. Um, so I guess with that being said, I would love to kind of just anyone on the research team to share maybe some just tips on ways that we could dial it in and step it up. If there were some things that could improve our testing scores, what would your suggestions be? Just anyone can answer that.
I mean, can you be more specific? There's like, for instance, if we're talking about cognition, that's going to entail potentially different advice than, for instance,
Yeah.
improving participants' aerobic capacity so they can walk longer outdoors or something like that.
Perfect. Yes. So maybe we could what's something we could do cognitive wise, nutrition wise, and physical wise, maybe those three, socially, just our lifestyle. Yeah. Speak to those various ones, and who feels most comfortable talking about the cognition piece?
I'll do the cognition one.
Yeah.
I think just naturally flowing from what we just talked about, there's only so much, unfortunately, that we can modify when it comes to cognition. A lot of cognition is sort of baked into the cake, if you will, because it has to do with things like age and biological sex. However, that doesn't mean that there's nothing that we can do about it. That also doesn't mean that there's not even substantial things that we can do to help protect us against and kind of hedge against that risk that comes as we naturally get older and whatnot. So the number one thing that we can do for ourselves is get active. When you look at the weighting on how protective these individual modifiable things are on something like the ANU ADRI, activity is one that's way up there. So the more just total activity you have in your day, the more you're going to be neurologically protected against these sort of disease states like Alzheimer's disease and dementia. Another big one, and I'm just going to combine these 2 points together, that have been particularly challenging over the last couple of years, because I'm not sure if you're aware, but we, are somewhere in the midst of a global pandemic, maybe towards the end, maybe somewhere around there, but still, unfortunately that really limited our ability to go out into the community and engage with other people and engage in sort of a lot of the activities that I'm sure a lot of us like to do. But those activities are very, very important when it comes to cognition. Things like social engagement and cognitive engagement as well. There's a whole bunch of different ways that we can get these things. With social engagement, it can be hanging out with friends. It can be, going to see your family, going to see your grandchildren, something like that. All of those things engage our minds socially and make us think about those interpersonal interactions, and that actually has a profound effect on cognition. Additionally, cognitive engagement is important as well. So things like reading books, reading the newspaper, crossword puzzles, Sudoku, whatever it is, whatever you try to do that gets your brain thinking. There's actually a couple people in our study who have gone back to school. Great. Whatever that looks like to you, try and maximize both of those things. We want to be seeing other people and engaging with them. If that means that you can't see them in person because of, the health concerns and things like that, that's fine. But we have opportunities like this. This is a good example right here. As well as cognitive engagement as well. Do those type of things. Do your crossword puzzles. Do whatever it is that gets your brain thinking. Those are both very important components as well. And we've noticed on the when we do ANU ADRI and some of these other instruments, that unfortunately the pandemic has negatively impacted those things, made them a little bit more difficult. But now that things are starting to open back up again, be safe, but also make sure you're getting your brain working and you're interacting with other folks. And one more note on that. Sorry, I know I'm super long-winded. One other major sort of issue that crops up at a certain age is a lot of people retire. They don't want to work forever, understandably, and so they retire. Retirement, definitely, it's great, it gives you more free time to do the things that you want to do, but there's pitfalls associated with that. And one is engagement becomes harder. When you work at a job, you have to engage with people. You have to have social engagement and you have to have cognitive engagement often to complete the duties of your job. When you lose those things, it's very important that you, in some capacity, replace them. So if you are one of those individuals that are in retirement, I would ask you to think about, how can I do those things better? How can I get myself engaged and take care of that brain health? Because that's really important. And then the last thing I'll talk about is just paying attention to your diet. Unfortunately, there's not, first of all, as a modifiable protective factor, diet isn't enormously protective of cognition. It is protective though, and it is something we should focus on. So the primary thing that we need to do is, number one, we need to all eat a healthy diet in general, because things like obesity and things like that are actually risk factors for cognitive disease as well. But when we look at our diet and we've sort of dialed in the basic components of health, are we eating with enough regularity? Are we eating a balanced diet, right? Are we eating a varied diet and getting enough micronutrients? All of those things are very important. But when it comes to cognitive health, broadly speaking, there's two things that we know affect cognition, and I've already touched on them briefly. But number one is the consumption of raw or non-fried fish. The primary reason for that, though, is because fish contains, a lot of fish, particularly oily fatty fish like salmon, contain a high degree of omega-3 fatty acids, and those are very, very brain healthy and neuroprotective. So, and also, unfortunately, the standard American diet contains a very low amount of them as well. So be cognizant of that. If that involves taking some kind of a supplement or something like that, that is something that at least I would encourage. But those things help protect your brain as well. And then the other thing is, for whatever reason, I'm not telling you to go out and get drunk, but we know that having 1 to 2 drinks a day actually is neuroprotective. If you're not a drinker, it doesn't make a huge difference. So if you're someone who just, I'd rather not drink, I want to stay away from it, it's really not going to make a huge difference either way. But a small amount of alcohol can be neuroprotective. So maybe have a drink here and there. Maybe just have some fun with your life, because at the end of the day, that's what we're all looking for anyway. That's all I got to say about that.
Just to add on to that, like making sure of what's considered a serving of alcohol. Like,
yes.
down here we got hurricanes,
Yes. Yeah. A drink does not mean a gallon. A drink means 1 small glass of wine or 8 ounces of beer or something like that. But my point is, like, we, typically we think of alcohol as maybe not being healthy. But what we've seen is that in very small amounts, it's actually neuroprotective. And again, that doesn't mean, party time, let's go out there and get wasted. But a drink here and there is actually good for brain health. So don't, you don't need to be a teetotaler to be healthy, I guess is my point.
Yes.
I would encourage you to think about how many grams of sugar are in that hurricane.
Yeah.
Just for the mixed drinks in particular.
Yeah.
I know I was in New Orleans once and they served it in a 32-ounce cup. And I was like, what in the world?
Well, you're supposed to carry it around all day,
Yeah.
Oh my goodness. Well, anything, those were, I have like five things you touched on, Anthony. Would anyone else on the team like to share, add on to what he suggested? Anything else?
My general advice would be to, we know your adherence numbers to your health coaching sessions with Natalie are going well, and they've actually increased over the past year, which is great. So my advice is to take her advice. It's one thing to sit in on meetings. It's one thing to take the meetings, and it's another thing to actually put it into practice. So, just simply put, if you have physical activity goals, if you have nutrition goals, if you have cognition goals, you and Natalie know those better than any of us know them. So listen and take her advice, and whatever goals you guys are wanting to put into practice, do just that. Don't just schedule the meetings and sit there and talk. Although that's great. Social engagement, check. if you have goals outside of that, work towards those goals, because ultimately working towards small goals are going to help us get to our bigger goals. So don't just sit in a meeting, actually put what you guys are working on into practice.
Thank you for that, Megan. And like Stacy and I were talking, and we put it out there that you've got 2 coaches now. So we encourage you on this last leg of the study, double down on coaching. Like, you can coach with Natalie, and you can have, like, if you coach with me this month already, you can schedule a session with Stacy this month too. Like, let's go. Let's roll up those sleeves and integrate this work, because I know all of you are so experienced. You've got life under your belt, you know yourself. So this is the opportunity to really integrate that knowledge, that self-knowledge, and put it into practice, as Megan said. And that's what Stacy and that's what we've been trained to do. So we want to support you in, if you're facing retirement, or if you're wanting to work on your diet, as Anthony was talking about, brainstorm ideas that make sense for you. Take advantage of us while you still have the opportunity. Thank you. Anybody else before we open it up to any other questions today from participants that you would add that I didn't ask about? Okay. Thank you all. Megan, Anthony, Cody. Oh yes, Cody. How could we not forget Amazon cards?
That's right.
This is why we're all here.
I figured you'd all want to hear from me.
Yeah, tell us about that.
So whenever you schedule your appointment, and whenever I get that confirmed, I put in an order for your gift card. And once we have your schedule set and you come in for your appointment, I will get you your final, this gift card will be $400. I will get that to you within 7 days, 1 week. So if you haven't gotten it by that 6th day, I promise you it will be there by the 7th. But plan on seeing that shortly after your appointment.
Yeah. Another question I've been getting a lot lately, Cody, is when can, like, some people, their last month is going to be like this month, just or next month. When can they maybe expect to hear from you on on scheduling their last test date?
Okay. So we are actually, the schedule, I finished up the schedule this week. We will start rotating the schedule in and getting people appointed. And once, so the people that are due for their middle of February, they will be getting an email from me within the next week to 2 weeks. And then people that are booked out to like April, that would be the first part of March. So anywhere from 2 to 4 weeks out from their expected date, they will be getting an email. And very similar to what, if you remember Sally, very similar to what Sally did, you will get an email with a set of times that you can pick from, that's within 1 to 3 weeks range of your calendar appointment. So be on the lookout for that.
Just want to thank you all for, I know this has been a journey, and some of you still have a little bit to run to get to that finish line. And I feel inspired from today. What a great team. I feel blessed to be a part of working with such intelligent, heartfelt people, the research team, Stacy, and all of you. All of you just had this desire. You felt compelled to contribute to the research of this disease. I know a lot of us, myself included, have a family member or someone close that we love dearly that has either had a form of dementia or presently does. So I know this really has deeper values for all of us. And you're a part of this, and just a thank you for that. So yeah, in closing, if any other questions come up if you're listening to this later, don't hesitate to submit them to Stacy or I, or to the research team. We'd be happy to get back with you on that. And just to close with a quote from Nelson Mandela, he said, "May your choices reflect your hopes and not your fears." So in this new year, let's make those choices out of a place of hope, and just move forward in that. And as we've heard the resounding message today, there's reason to just take flight, and let's really just finish strong. And yeah, so thank you all for being here, and we look forward to talking to you again really soon.
Thanks so much, Natalie, for organizing this. I really appreciate everything that both you and Stacy do for the team, and definitely for the participants.
Mhm. Yeah, thank you, everybody. It's great to see some faces.
Have a great weekend, y'all. Okay, 2 glasses, that's it. Bye-bye.